So let's change gear a little bit and talk about arthritis. So how would one know that they have arthritis?
Let me talk about, again, the information which is rather scarce. Yes. You will find that patients who are a bit informed, because there are others who don't know at all, the ones who are a bit informed will think that when they have joint diseases, then they go to see the doctor who deals with bones. That is what I hear so much out there. Even from patients who have moved all around and have been frustrated and they have eventually found a rheumatologist, you will find that they were referred to a doctor who deals with bones. Even when they will Google a doctor who deals with bones and joints, and what may come up is the orthopedic doctor. So you will find that the majority of these patients will go to the orthopedic doctor. Now, I'm talking about that because as we come to the issue of arthritis, you will find that arthritis, basically the definition is a painful, swollen joint. Arthritis is a painful, swollen joint by definition. So if you have a painful, swollen joint, then by simple definition, you have arthritis. I'm talking simple because arthritis is also, like I said, it can be systemic. It can be looking like it is in your joints, but at the same time it's attacking your eye. So simply put, is a pain. And that is why now, if you have that painful swollen joint, then you are told you go to the doctor for bones and joints, which is the orthopedic surgeon. It's a surgeon. Then you see you've already been put off the right track.
So when we talk about this information about the disease that is rather scarce, so where can one get true information and accurate information?
You see, the problem is with us, majorly, doctors, because arthritis, to the extent that it is inflammatory, should be dealt with by a rheumatologist, or if not, then a physician. Because the other colleagues, they are surgeons. There is a stage of arthritis where a surgeon needs to be involved. And that one, if we are following things the way they're supposed to be done, the physician or the rheumatologist refers the arthritis case to the surgeon. Say if it is septic arthritis. Septic arthritis is a painful swollen joint because of an infection. Okay? And that joint may need to be drained to remove the pus. In that case, I will quickly, on diagnosis, refer this patient to the orthopedic surgeon, and he'll take this patient to theater and he'll operate. But if it's an inflammatory condition which is autoimmune, systemic, like say rheumatoid arthritis, if the orthopedic surgeon starts managing this patient with pain relieving medications, then is killing the patient. Because as you give pain medications, the disease chills the joints. And this disease can also get into the eyes. I've seen patients coming to me on a wheelchair, they can't walk because the disease has attacked their joints, and they can't see because the disease has attacked their eyes to the extent of perforating it. Okay. And as you treat it systematically, holistically, some of them still regain their sight as they come back into the office for review, walking. So we doctors are majorly to blame also for lack of information to the patients, because we are the ones who know. Yes.
So Doc, in your own practice as a rheumatologist and a physician, how do you get to educate the public about this disease?
I think this is one of the reasons that the clinic was established, to educate the public. And that's why we also have a website. We have this clinic as a website, crcnairobi.co.ke, where I've talked about some of these things. And that's why we are going as far as we are going today. Because helping patients is not just sitting and waiting for the few that will reach me. We are trying to educate the majority who may not reach me. And so even with this interview, we've started a solution. Yes, because for those who will watch this interview, they will know better, even just from what we have already said in that short time, that if you have a painful swollen joint, see a rheumatologist first. If you can't find a rheumatologist, see a physician. You will be safer. When we need the surgeons, we refer you to them. Yes.
One would say that this consultation is rather expensive, so I'd rather just remain not knowing.
Let me tell you, if you're able to find an orthopedic surgeon, you are out of that bracket. Because by seeing the orthopedic surgeon, you may end up having no hand to feed your mouth if you have rheumatoid arthritis. Because you will get painkillers as your joint deforms and you get disabled. How will you have hand to mouth? So if you are able to see an orthopedic surgeon, that is not the case. But at the same time, when we do an interview like this, it's going to be on Facebook, and everybody is on Facebook, from the house help, the motorcyclist, everybody is on Facebook. So that even the clinical officers who are working down there, the nurses, they're on Facebook. If they watch this, they'll be able to know better. And that's what I'm saying, by what we are doing, we are starting a solution. So that if the nurse notices that this patient has something which may look like, the nurses who run what do you call them, the dispensaries, if they realize that this patient has got a painful swollen joint, they'll be able to refer this patient to a physician. Now there are physicians in the county hospitals, and those physicians, we have trained them in rheumatology. So they can at least do something which is more informed, and if they can't, then it should be organized from the county government level for rheumatologists to do visits there. We are ready to do that.
So, Doc, are you saying that a general physician is able to diagnose rheumatic diseases?
Yes, a physician is able to see. That's why we do internal medicine first. Because rheumatology, rheumatic diseases attack internal organs, systems. So that somebody who understands internal medicine understand diseases which attack internal organ systems, and rheumatic diseases are majorly part of them also. And we train them in rheumatology. These days they are trained, so they can be able to diagnose and treat to the extent whereby they can be able to treat. When they are not able, they can be able to look for a rheumatologist. And that's why I'm saying the county governments, because the rheumatologists are few, they should organize for rheumatology clinics to be done there, so that maybe even with the rheumatologists going there, they can train the doctors there even better.
So currently in Kenya alone, how many rheumatologists do you think we have, in your own opinion?
Right now there are about 10, 12. The hospitals which have them mostly are provincial, a few provincial. Like we have somebody now close to being a rheumatologist in Nyanza Provincial General Hospital. We have a rheumatologist in Eldoret Moi Teaching Referral. We have in Mombasa Coast. I don't know whether it's in Coast General or it's in private hospitals, but there's one at the coast. That's the distribution. The rest, they are no rheumatologists. The rest are in Nairobi.
Would you say the situation is better now? Would you say that the number of rheumatologists in Kenya is growing, in your own opinion? What do you think?
Yes, the number is growing. It's not the way it was. When I joined in, I was the second one now in the whole country. Now we were two.
Now, do you think that there's a concern that some of us who are young, the young people, see these diseases as an old man's problem?
Is it a concern?
Very, very. To the rheumatologist, it is a big concern because people can't be more wrong. Yeah. Let me take, for example, just diseases which cause arthritis. There's a type of arthritis we call juvenile arthritis. The full name is juvenile idiopathic arthritis. That terminology refers to arthritis of children. And in this case, it is arthritis in people below age 16. There are very many. And unfortunately, while at Kenyatta National Hospital doing clinics there, we see children from remote areas of Kenya, like in the northeastern districts, who are able to be brought to Kenyatta because their problems are not being solved. You find they were just simple juvenile arthritis, which if it was treated early, the child would have been saved. But by the time they come, the child has joints which are fixed, swollen and fixed, and you cannot reverse that. Some of those joints are the knee joints. So this child and the ankle joints, they cannot be able to walk. Some are the elbow joints, the wrists, they cannot be able to feed themselves. And those are now irreversible. You find even a juvenile arthritis which started early in life, was not recognized, was treated for the wrong things. A patient now reaches us at Kenyatta Hospital when they are 25 years old in a wheelchair, fixed in all joints including the neck, can't move. It's a very sorry situation. And so the issue of arthritis being a disease of the elderly people is one of the things that we are trying to sort out even by doing this interview, because arthritis can attack somebody of any age. It only depends on what type of arthritis. Old age is the mechanical degenerative arthritis. Inflammatory arthritis will attack from any age, including the infant.